What is an endoscopy and how does it work? What symptoms lead to an endoscopy being recommended? Hello, my name is Dr. Chintan Parikh. I am a gastroenterologist with Norman Regional Health System. I am practicing in Norman, Oklahoma for last 23 years. I am here to answer your questions. Endoscopy means to look inside. These are long tubes with a camera inside. We can see the pictures on the monitor. We can use different type of instruments to take some biopsies and do therapeutic maneuvers to treat GI bleeding or to remove polyps. We can do upper endoscopy to check the upper part of the digestive tract that includes esophagus, stomach, and part of the small intestine. Colonoscopy is used for screening for colorectal cancer. It is also used for evaluation of bleeding per rectum, chronic diarrhea, and change in the bowel habits. There are also specialized instruments to take a look in the small intestine, which is approximately 20 feet long. And then there are instruments for endoscopic ultrasound and ERCP that can take care of bile ducts and pancreas. Upper endoscopy is done to evaluate different symptoms and conditions. It is very useful for the evaluation of symptoms like nausea, vomiting, heartburn, problems swallowing, abdominal pain. You can diagnose various conditions like esophagitis, that is inflammation of the esophagus, narrowing in the esophagus, hiatal hernia, ulcer disease. We can stretch the esophagus when there is problem swallowing. Also, we can diagnose causes of upper GI bleed. We can treat the bleeding from ulcers by cauterization and clips. Upper endoscopy is also used for screening in certain conditions. Patients with long-standing heartburn can develop a precancerous condition called Barrett's esophagus that can lead to esophageal cancer. We recommend screening in patients with long-standing heartburn and certain risk factors like obesity, tobacco use, and alcohol use. Screening is also used for patients with liver cirrhosis who can develop abnormal blood vessels in the esophagus that can cause significant bleeding. There is no age-based recommendation for upper endoscopy. If you have heartburn 2 to 3 times per week for more than 5 years, it is a good idea to get endoscopy done to rule out Barrett's esophagus. Patients who have family history of stomach cancer, in addition to smoking and alcohol, should get upper endoscopy done also. With upper endoscopy, we ask the patient not to eat or drink anything after midnight. They can take some of the medications with small sip of water 2 to 4 hours before the procedure. They do have to stop their blood thinners, and if they are on semaglutide medications for weight loss, we ask them to stop that a week before. Upper endoscopy is done with sedation. The procedure may take anywhere between 5 to 10 minutes. After the procedure is done, they go to the recovery area, and usually after 30 minutes, they are discharged home. There are few conditions in which we have to do a follow-up endoscopy. If we find an ulcer in the stomach, we treat that and repeat the endoscopy in about 3 months to make sure that ulcer is healed, because sometimes a stomach cancer can present as an ulcer. There is a condition called eosinophilic esophagitis, which involves younger patients more commonly. It is inflammation mediated by allergy cells and it can cause problems swallowing. When we find this condition, we treat with appropriate medication and recommend doing another endoscopy in 3 to 4 months to make sure that this has healed completely. Upper endoscopy is relatively very safe procedure. There can be bleeding or perforation. There also can be side effect of anesthesia. This can affect your blood pressure and breathing, particularly if you have certain diseases. The risks are quite low, usually 1 in 1,000 cases, and particularly if we have done any therapeutic procedures like stretching the esophagus or removing a large polyp. If you are developing significant abdominal pain, vomiting, blood in the stool or black stools, unexplained weight loss, please speak to your doctor to find out whether you need an upper endoscopy or not.